Hi, this is Dr. Robinson, and I would like to give you a little explanation about why you should be concerned about this neck or back problem. And the reason I say that is I get a lot of people who, for some reason or another, they think they should just tough it out and show everybody how tough they are, not do anything about it. Well, in the long run, there are some things that happen if you don't take care of a problem like this. And what we're talking about is problems up here in the neck. And if there's an issue with the spine, it can affect the nerves all the way down through the shoulder, arm, and into the hand. People with mid-back problems, it may be a problem right there, or it may be a problem up here in the neck that's referring pain down into that area. We get a lot of people with low back. That's one of the most debilitating problems in this country. Problems in the low back, most people are familiar with sciatica, the pain that goes down the leg, maybe into the feet. But for this little talk, what I'm going to do is talk about the lower back right here. You've got the ilium on either side, sacrum right in the middle, and the lumbar vertebra that go up and down through there. If we take a look at a diagram of that, over here you see the ilium on this side, other ilium on this side, sacrum in the middle, lumbar vertebra. And if you look at this little drawing, you'll see a mammary process on each side right there. Those are just protrusions that give a greater surface for ligaments, tendons, muscles to attach. Right in the middle, you'll see the spinous processes that stick out. Those are the things that you can feel, that you can reach back and touch, that stick out from the spine itself. Now, if you look at it very closely, way down deep, you see the disc that fit right in between those vertebrae right there, and that's what most people are concerned about. When a disc goes bad and starts to protrude or break apart, it creates a tremendous amount of pain. And what I'm going to talk about is what you can do to keep that from happening, to keep it from getting that bad. Down deep, you have the disc that fit in between the vertebrae. They are a fibrous tissue, and they have to have nutrition. They have to have fluid. When you have an MRI, one of the early signs of a disc going bad is loss of water content, dehydrated disc. So we're definitely absolutely concerned about that, but you can, if you do the right things early on, prevent a great deal of that. Now, down deep around these vertebrae, you see little ligaments that run up and down the spine, cover the outside of these joints right here. And on the outside of those ligaments, you'll actually see you'll begin to see the muscles, the intersegmental muscles that run in between each of these, and the longer muscles that run in between the spinous processes right there, all the way up and down. Each of these have muscles in between them, and that's how we move and get around. Twisting, turning. One of the things that you need to be concerned about is that disc way down deep in there. It has to have motion. It's a living tissue, so it has to have nutrition, it has to have fluid going in and out of it, but you get that by moving around, by twisting, turning, walking. As you go through the day, you use all of these muscles and you twist and turn. You've got all these deep muscles here that run between there. You've got the bigger muscles that run from the sacrum over to the femur. And, whoops, wrong way. You've got some very large muscles like the gluteus maximus that run down through here that help move the femur, move your leg. Gluteus medius and minimus that come out on the side right here. Quadratus lumborum up here that run from the ribs and attach to the ilium right there. You've got other muscles that overlay that. In the front of the spine, you've got the iliopsoas that run. I'll put a dotted line because it runs in front of the ilium and goes down and attaches to that femur. So, great deal of muscles that are layered on top of each other that give us the ability to move the way we're able to move. And as you walk, as you take a step, when you raise the left leg, this is an exaggeration, but when you raise the left leg to walk, the spine will actually curve a little bit to that side right there. And then when you raise the other leg, you'll see the spine twist a little bit to the other side. Once again, this is a big exaggeration. But all that motion in there works fluid into and out of those discs right there, and helps them keep them hydrated, helps keep them healthy. Problem that you run into is that when you lose motion, those joints become locked in place and they begin to dehydrate, and just like a tire going flat, they start to bulge around the edges. And we see that the disc fits right in here. And if it starts to dehydrate, it'll start to bulge a little bit right in there. May bulge a little bit toward the back. The spinal cord runs right down through here, about that area right there. And then at each level you have the spinal nerves that come off and run to all the different muscles, all the different organs of your body. So the thing we're concerned about right here is this disc that fits right in here. And when it becomes dehydrated, primarily due to lack of motion, the spine getting jammed up, not moving, you don't get the fluid exchange. When you get about the age of 21, the body no longer pumps blood into that disc right there. It will pump blood into the body of the vertebra here. And then as you go through the day twisting and turning, it works fluid and nutrition into that disc. And that's how your discs stay healthy. However, because of you have ligaments that run up and down through here, and if you get a bulging right there, it presses that ligament out, creates inflammation in the area. And in that inflammation, the body responds to that by putting calcium in the area. So you have these big bone spurs that begin to form right in here. And it actually, those bone spurs actually occur all the way around the surface of that vertebra. The vertebral plate will begin to look white. It's what they call sclerotic. And if it goes on long enough, you'll see little bone spurs in through there. Bone spurs sticking out toward the back. If it gets bad enough, it may actually start to press on the spinal cord, and that's what they call spinal stenosis. You don't want spinal stenosis, because if it gets bad enough, then you start having weakness in the legs, having trouble walking, can't do the things that you want to do. So it's really important that you keep these discs hydrated. How do you keep them tight? How do you keep them hydrated? By movement. You just have to move them to keep them healthy. So if you want to keep the spine healthy, then that's the thing that we're doing all of the time, is restoring motion to all these different joints right in here, and making all these joints move again so that the discs stay hydrated, so that the discs stay healthy, so that they do not push back against the nerves and create a problem where you may end up having surgery or loss of mobility. So this is the reason why you need to make sure you keep the spine healthy and moving and functioning again, because movement is critically important to the health of that spine and keeping it healthy. So that's the reason that you should be concerned about this.